I'm going to talk about the dry eye with the IPL treatment using various filters. I almost gave the same talk the last year, but we have a little bit upgrade of this talk. So how can I go forward? Okay, I don't have any financial interest to disclose. As you know, what is the IPL? This intense pulse light is not a laser beam. The laser is a monochromatic single wavelength beam. Instead, IPL light is a wide spectrum from the 400 to the 1200 nanometer. So IPL can target any chromophore in that range, such as the oxyhemoglobin and melanin. So when you want to use the IPL, you have to block certain wavelengths. So from there you can have a selective photothermolysis is possible. And what's the mechanism of the action of the IPL on the dry eye? I think it's rather complex compared with the dermatological field. Because the mechanism of IPL is for the treatment MGD is not fully elucidated. Maybe the main mechanism is the photodestruction of the vessel is the number one. The mechanism, destruction of superficial and deep blood vessel is the main mechanism, we think. There has been many published papers about the clinical study saying that it's effective. Also many meta-analysis papers about the IPL. And most of the meta-analysis papers said that IPL for treating MGD leads to the improvement of both symptoms and several ocular surface parameters. In addition, there is increasing evidence that IPL is a safer treatment modality for the MGD. And this is there is many, maybe 5 or 6 IPL the machines in the market. And this is another one paper published in the 2022. It's a meta-analysis paper. It says that the Luminis M22 is the most popular one. I think the reason is that the IPL, the Luminis papers already been used in the dermatological field, and it has several light filters and light guard, so it gives many options, much options for the clinicians. So I think this is maybe the reason for the Luminis M22 is popular. They have 9 filters available in this Luminis M22 model, the 7 cutoff filters and 2 notch filters, acne and vascular filters. And then we're interested in this acne and vascular filter, which are supposed to remove the blood vessels efficiently, hopefully removing the telangiectal vessels in the lid margin. So we did a study, compared to 3 filters, 190, that's the most popular one, 190 filter, and acne filter, and vascular filters. So this 190 filter, block all the light under the 190 nanometer. So when you look at this one, so it can good for the melanin destruction, but it's not good for the destruction of the oxyhemoglobin. So actually blood vessel. So theoretically, this is 190 filter doesn't have any effect on the blood vessels. And compared to that, this acne filter has a dual wavelength band, single emission, which was the 400 to 600 nanometer and 800 to 1200 nanometer. So 400 to 600 wavelength light covers the area where oxyhemoglobin shows a peak light absorption. So therefore, this filter can provide a significant destruction of superficial blood vessels without damaging the surrounding tissue. And vascular filter is a little bit different. The vascular filter has a longer wavelength than the acne filter. So theoretically, it can penetrate deeper and destroy to even deeper destruction. So first, the acne filter. So we had some the study in moderate to severe MGD patient. We compare the effect of the IPL treatment with this acne filter, especially for the effect on the lead margin telangiectasia was evaluated. We performed 4 sessions of the upper lid and lower lid IPL treatment with the meibomian gland expression at 2 to 3 weeks interval. All cases were assessed with the here MGD9, BUT, staining score, the OSDI, and MG, the function, and lead margin telangiectasia. After treatment, there was a significant improvement in TBUT and the staining score, as well as the ocular irritation symptoms, but as we expected, no change in Schirmer test. There was also improvement of the lead margin telangiectasia, upper and lower lid eyelid, and also improvement of the gland function, such as meibomian color and consistency. MMP9 level is also significantly decreased. And as you can see here, lead margin telangiectasia showed improvement pre and post. You can see there's improvement telangiectasia. And IPL treatment of this with acne filter was very effective, and there is no serious adverse effect. And then we did a comparative prospective study. We compared 190 filter with this acne filter. In this study, 190 filter for one eye and acne filter the other eye. So we use the same protocol for sessions of upper and lower lid IPL treatment with a 2 to 3 interval. And you also check all parameters, MMP9, the Schirmer, BUT, and staining score, and lead margin telangiectasia, and so on. So the BUT and the staining score and subjective symptoms, they all increased after treatment in both groups. So 190 filter group and acne filter group. Again, there is no change in Schirmer test. And how about telangiectasia? Telangiectasia is improved both group, and meibomian gland is improved both group. MMP9 is decreased in both group, but unfortunately, there is no difference between the 190 filter and acne filter in terms of the telangiectasia improvement. Here, you can see that there is no statistical change. So actually, we expected more effect in the decreasing telangiectasia with acne filter, but it didn't work. But anyway, in summary, comparison of this one, the effect of acne filter treatment is comparable with the 190 filter. Acne filter treatment seems more effective because there is more responders in acne filter group, but again, this is not a statistically difference. So then we test the vascular filter. The vascular filter is designed to emit only more than the 530, designed to 530 nanometer of light, so the energy can be intensively transferred to the vascular region of the dermis in deeper vessels compared to the acne filter. So targeting the more oxyhemoglobin superficial vessel and deeper vessels. And also this is also the same protocol, the upper and lower IPL treatment for sessions, the 2 to 3 weeks interval, and we check BUT, Schirmer, MMP9, and the staining, the lead margin telangiectasia for everything. So you can see the improvement of telangiectasia of the lead margin, and so here you can see the BUT, the staining score is improved, and telangiectasia lead margin was improved, and Webom score and color and consistency is improved. MP9 level is decreased with this vascular filter. And when you look at these pictures and pre and post, so we think vascular filter is very effective. Actually, no serious adverse effect and no change in the vision at all. So we think that the vascular filter is also very good. And at this time, we did some univariate and multivariate analysis. What's the prognostic factor? So we found out using this vascular filter, AG, and the staining score and movement constancy is a good prognostic factor, but it's contrary to our think. Actually, the most severe staining score and the worse movement quality and younger patient responds better. I think this is unlike in other studies showing the less severe patient respond better. So we think this conflict result can be the mainly attributed to the vascular type. So the filter type makes a little bit, makes everything is a little bit different. So I'm going to reiterate that the more severe MGD patient and younger age is a better response to this vascular filter. So also we check that the effect of this vascular filter, the telangiectasia, we compare this vascular filter and acne filter. Unfortunately, there is no statistical difference. It seems a little bit better in the vascular filter, but no statistical difference. So this is a take-home message. So IPL is a very effective or safe procedure for the treating MGD, and 190 filter, acne filter, vascular filter, they're all effective. But vascular filter better in severe MGD and younger patient. So if there is anyone who is using the only 590 filter and acne filter, I recommend to use this vascular filter for some severe patient. Thank you very much.